Knock. Washing my hands. First, do I have your permission to film this video today?
Sure.
Great. How should I address you?
Kevin.
Nice to meet you, Kevin. I'm Laura. I'll be your nurse practitioner today. Today we'll be performing a full neurological examination. Is that okay with you?
Sure.
Great. First, can you just tell me your name?
Kevin Bishop.
Great. And where are we right now?
The doctor's office.
Awesome. And what year is it?
2025.
Great. And 0 to 10, are you experiencing any pain today?
No, 0.
Comfortable with this
Yep.
exam and where we are?
Yep.
Okay, great. First, we're just going to start with some facial movements to test cranial nerve 7, which is your facial nerve. So first, I'm just going to have you smile with your mouth closed. And can you frown? Okay. Can you smile with your mouth open? Perfect. And can you puff out your cheeks? Good job. And one more. Can you wrinkle your forehead? Perfect. Good job. Next, we're going to test cranial nerve 11, which is the spinal accessory nerve. So I'm just going to have you first shrug your shoulders. Great. And now we're going to do that same thing. I'm just going to apply a little bit of pressure as you do it, okay? Good job. Next, we're going to check your sternocleidomastoid muscles. So I'm first going to have you turn your head to the right, and then you can come back to center, to the left. Great. And now we're going to do that same thing. I'm just going to apply a little bit of counter pressure to the side of your face, okay? So turn to the right, and now come back against my pressure. Good job. And we're going to do the same thing. And good job. Now we're going to test some motor function. So first, I'm just going to have you alternate your hands palm down to the back of your hands on your thighs, and we'll have you repeat that motion and go as fast as you can. Good job. You can stop. Next, we are just going to check the accuracy of point here. So I'm going to have you touch your nose and then touch my index finger. Good job. And back. More. And back. Okay. Now we're going to do that with your other hand. And then to my finger. Good. And back. And to your nose. And to my finger. Good job. Now we are just going to check the accuracy of your lower extremity. So I'm going to have you take your heel and you'll run down your shin with your heel. Move my camera. Good. And to the other side. Great. Now we're going to check your balance. So I'm going to have you just stand up and feet are about hip width distance. You'll close your eyes. A little bit of swaying is normal, but I don't see any significant swaying. Are you experiencing any dizziness?
Nope.
Okay, great. You can open your eyes. It seems your balance is intact. Next, I'm just going to have you walk to the end of this room at that doorway and then walk back. Let me just get my camera set. Okay, you can turn around and come back. Your stride is smooth, posture is upright, and arm movements are simultaneous. There's no swaying. It doesn't appear that you have any weakness. The gait appears normal. You can go ahead and have a seat. We're going to test some sensory function now. First, I have a little cotton swab here. So I'll have you close your eyes and then you'll point to where I touch you with this cotton swab, okay?
Okay.
Great. Okay, now we're just going to check superficial pain. So I have a paper clip here. I'm going to gently poke you with a sharp side and a dull side. If you can just tell me which one is sharp and dull, just so you can tell which is which with your eyes open. This is sharp and this is dull.
All right.
Okay. So go ahead and close your eyes and then just tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull.
Okay, great. And we are just going to test your sense of perception here. So I'm going to have your hand here. I have your thumb, and you're going to close your eyes and tell me, you can go ahead and close your eyes, and then this will be up and this will be down. And you just tell me if you feel like you're up or down.
Okay. Up. Down. Up. Up.
Okay, we're going to do that on the other side.
Up. Down. Down. Up.
Good. Now I'm just going to test your ability to identify a different object in your hand. So you can, close your eyes, and then I'm going to place an object in your right hand. If you can just feel that object and tell me what it is.
Some sort of coin.
Good job. And then I'm going to place an object in your left hand. Same thing.
Feels like keys.
Awesome. And now I'm just going to check a 2-point discrimination test. So on your hand, I'm going to have you tell me if you feel 1 poke or 2 pokes. Okay?
Okay.
So same thing, eyes closed again.
1. 2. 1. 1. 2.
We're going to do that on the other side.
1. 1. 2. 2.
Great. Now we are just going to test your ability to identify an object as I write on your hand. So I'm just going to draw a number on your hand. You tell me what number you think it is.
8.
Okay. And then we'll do the other side.
1.
Perfect. Good job. Next, we are going to check your ability, sort of like we did with the cotton swab. I'm just going to point to a spot on your body, and you'll point to that area.
Okay.
So close your eyes. Perfect. Next, we are just going to check your reflexes. So first, we're going to start with your biceps reflex. Perfect. We'll do this side. Perfect. Biceps tendon is intact. Next, we're going to check your brachioradialis tendon. And the arm slightly pronated. Same thing on this side. There we go. And now we are going to check your triceps tendon. Slightly out of camera here. Okay. And triceps tendon. Great. Triceps is intact. Same on this side. Supporting here. Great. Next, we're going to check your patellar tendon. So I'm just going to support your knee while I check your reflex here. Good. And then same thing on this side. Good. And then we're going to check your Achilles reflex. So I'm going to support your foot here at the ankle and strike the back of the Achilles tendon. Good. And other side. Good. And then we have one more reflex to check. That's your plantar reflex. So I'm going to use the back of my reflex hammer to trace the bottom of your foot. Okay. Good. And other side. And that concludes my neurological examination today. Did you have any questions?
No, don't think so.
Okay, great. Thank you for your time.
Thanks.